We are now going to hear things from a medical perspective. Dr. Ben Brown is an obstetrician and a gynecologist practicing in Rhode Island and a fellow with the Physicians for Reproductive Health.
Good afternoon. I am here today in strong support of the Reproductive Healthcare Act. My name is Dr. Ben Brown. I'm an obstetrician gynecologist. I practice here in Rhode Island. I'm a fellow of Physicians for Reproductive Health, and I'm a member of the Coalition for Reproductive Freedom. I'm here today because I trust my patients to make decisions about if, when, and how to raise a family. I'm here because I want to be part of making healthcare safe and accessible to all Rhode Islanders, no matter a person's race, their gender, their sexual orientation, what language they speak, or their place of birth. That means having access to empathetic and responsive prenatal care. It means access to a doula in labor. It means that every patient should have access to the contraceptive method that is right for them, and yes, it means access to abortion. I grew up in Providence in Boston, but I trained in Chicago, a city where access to care there was good access to care, but where we were surrounded by places where there was not access to abortion. Every week I saw patients who traveled hundreds of miles to get to my hospital because they lived in places where they simply could not access comprehensive health care. I remember one woman, I'll call her Jenny. She had traveled to our office from Indiana. Jenny found out around her 5th month of pregnancy that her fetus was affected by multiple birth defects. When she asked her obstetrician for help obtaining an abortion, she was told she could not get the procedure in Indiana. Fortunately, Jenny had the ability to come to Illinois for care. That means before she had even made it through the door of our hospital, she needed time off of work, transportation, a place to stay in an unfamiliar city, food for the trip, and money for all of those expenses, not to mention a support person with all those same resources. Many people are not as lucky as Jenny. Jenny was able to get the care that she needed, but many people would simply not have been able to surmount the barriers that Jenny did. Now that I'm back home in Rhode Island, I want to be part of making sure stories like Jenny's become a thing of the past. And I know that change is possible. I witnessed what happened in Illinois when the legislature passed a law expanding Medicaid funding for abortion. I remember sitting with more than one patient as she cried in relief when I told her that her insurance would pay for her visit. That she wouldn't have to make a decision about paying her rent or paying for health care. My experience in Illinois taught me that what we do here in the legislature makes a difference in real people's lives. Today, reproductive rights are under attack in states across this country. They are under attack in the federal government. That is why Rhode Island must take a stand to protect the right to abortion for all people seeking care in this state. Today, we ask the legislature for something that is quite frankly, it is very modest. We ask the legislature to stand with us and in a clear voice say to all Rhode Islanders, in this state, no one will take away your right to comprehensive health care. Today we ask the legislature to pass the Reproductive Healthcare Act.